Hello, welcome back to Superhero and Super Zero. I'm your host, Javed Khan. Today the topic is about healthcare loss. Since this crisis started, nearly 50 million people have lost jobs in the country, including healthcare workers. Healthcare workers have lost between 10 to 20% of the jobs, depending on what source you're looking at. Most of these people have either lost job either entirely or have considerably reduced hours. When I said healthcare workers, frontline healthcare workers, including doctors, some specialty have lost a lot of stuff. Nurses, rehab specialists, physical therapists, OT, PT, speech therapists. You also talking about nursing assistants, dietary people, and of course housekeeping people. When you're looking at TV or listening to radio and you're listening to the reporters, anchor men and women, specifically the business reporters and anchor men and women, and when they're talking about getting coverage when you lose your job, the insured people can get COBRA. They can get individualized healthcare plan through the various insurance company, the Affordable Care Act, or Medicaid if you qualify through your income. What these reporters and anchor people will not tell you is what is the average cost of premium through the average for the average workers. What is the cost of COBRA, the exorbitant fees for that? The individualized healthcare plan, how much they will cost and how little they cover and how high their deductibles are. Basically, they're only good for if you go to a hospital. They don't cover your specialist, they don't cover your pharmaceuticals. The Medicaid is also a process. If your income is just a few dollars more, then you don't qualify. The reason they won't tell you is because the media business is through selling ads, advertisement. When I was going to gym not too long ago, there were 10 different channels for me to watch right up there. And 6 of them were from 6 different TV news networks. And yet most of these channels, majority of the commercials were from health insurance company, through drug companies and investment companies that invest in hospitals, healthcare facilities, and health insurance companies. I'm sure most of you remember not too long ago, and every year, especially election years, you hear the pitch by some politicians saying, if you like your health insurance plan coverage, you can keep it. Well, guess what? If you lose your job, you will lose all that, unless somehow you can afford to pay the exorbitant COBRA fee. I guess they have to have a high COBRA fee because they have to pay the politician their fee, aka political donations. They don't tell you how little coverage is from individualized healthcare plan. What are their executive CEOs making selling us these individualized healthcare plan? Today, what we need in America, the richest country in the world, and we have been that way since 1945, for 75. Yet we have the worst healthcare plan in the developed world. Look at Canada, just across the border, Europe. And what we need to have here is a single payer healthcare system, that one that does not based on employment. or person can afford to buy the health insurance, because things can change very quickly. Since COVID-19 started, look how quickly people just lost their jobs, 50 million of them. Look at how long some of these people who used to work are waiting in lines to get some free food. Some places, just to get the COVID-19 test, I was watching on TV the other day, someone waited 10 hours. Yet some of these health insurance companies, the CEO is making 25 million, 50 million dollars. And that's why we need the single health paid insurance to cover everybody. It's not based on your jobs, it's not based on your affordability, it's based on your need. Today what we have is for-profit healthcare system, and the number 1 through 9 things are profit, and more profit. Thank you. We'll talk about it next time, a little bit more in detail about health insurance company.